big concern that we saw with this guidance, and one of the reasons we decided that CRN needed to act to push a conversation with FTC, is their heavy reliance on statements that suggest bright line requirements for randomized clinical trials. And there is definitely a place in the substantiation kind of regime for those types of studies. But you really need to look at the type of claim being made and determine the best way then to go about having flexibility for the guidance. And that is definitely borne out in the law. Courts have supported that for 20 plus years, since not only DSHEA was enacted, but the guidance was first put out in 1998. And we've heard the FTC continue to kind of talk about this flexibility when we've staff comments, for example, from a FTC staff attorney that joined us in New York City at our legal conference. They recognize there should be flexibility, but they don't really say it in the guidance. So that was just, I think, a lot of the impetus for why we felt this was really, really necessary to write this petition. And we're really hoping that it will give the staff and the leadership at FTC a lot to think about and spur additional conversations moving forward.
So in 2009, the FTC first made this push to try, and they said be more specific, but what they were doing is pushing clinical trial standards. So saying any kind of dietary supplement claim is going to need a clinical study. They've won on that with disease claims, and I think in a lot of cases, the courts agreed. So we agree, that's fine for disease claims. But when they tried to push the same kind of very rigid clinical trial standard that you have to be testing the full product, all this kind of stuff, onto structure function claims for dietary supplements, the courts on 3 different occasions in big cases didn't go along with it. But the issue that we have is that the guidance seems to suggest that any health-related claim, and health-related claim isn't even a term that's used in like the FDCA in the Food and Drug context. So it's hard to know, like, do you really mean any type of claim that might touch on health? Like, that's a little extraordinary. That then you might mean like supports the nervous system.
The FTC National Advertising Division, which is a self-regulatory body, has a lot of precedent around how to support, I'll call it health-related claims, not a defined term, but kind of gets at the structure, function, well-being, nutritional support claims that are permitted for supplements. They've all along supported ingredient testing in the right context. If you're talking about, vitamin C supports the immune system and you have a multivitamin product, you don't need to necessarily go test that exact combination of all the ingredients every single time. And it allows companies, the industry, information to consumers to be provided in a way that isn't going to be overly cumbersome and expensive. You don't have the same types of ability to charge or the same type of monopoly type exclusivity around these products like you would for a drug product, for example. And so cost is a factor, and that's not to say that the level and the type of support that they're using isn't going to be sufficient. It's that it's absolutely fine to test on ingredients if you're looking at your product and doing the other work to ensure that the rest of your ingredients aren't going to interfere with how you've tested a particular ingredient. And one of the things that companies need to remember is this is guidance. It's not the law. It's not court precedent. So when you're looking at substantiation, that's what still is going to govern. There's a great line in the petition that talks about the fact that just because the FTC, wants this to be the standard or is suggesting it's the standard, it doesn't mean that they can make it the standard. It's the FTC can no more change court precedent through guidance than they can convert cars from a factual standard to a legal requirement for RCTs. So the law says there's flexibility. Courts have said there's flexibility. Keep that in mind. And I think that's why this petition is so important, not only to educate the FTC, but so that companies can see what the court precedent is, how DSHEA was enacted, and what it means. And we know that class action litigation risks continue to be a big concern for the dietary supplement and food industry. And so I think there could be help there as well, that we've kind of laid out, here's what the guidance is actually saying. And hey, FTC, we'd appreciate that, now that we've viewed it through that lens, that the guidance is fine-tuned to go that direction. And I think another kind of, if we do have the opportunity to talk with FTC, the idea that we welcome dialogue so that companies who are trying to support structure, function, well-being claims have an idea what the FTC expects. But if it's too rigid, if you have so many disease examples that don't apply to the claims we can make, it's not going to be helpful for companies that are following the law and not making disease claims.